So a mare that fails to become pregnant after 2 artificial insemination attempts at the right time with good semen will benefit from being bred by live cover. There's a lot of people that say, you know, she's not pregnant with this AI, maybe it's the semen, maybe it's too little, whatever. Do you think that natural cover will benefit a mare that has not been pregnant with AI? Yes, no, depends on the mare or depends on the stallion. 10 seconds. We have to beat the record. We had 57 last time. Ah, same. There's more than 57 clickers out there, so. Okay? No. Well, I'm glad to see that. I would agree with that. No is the answer, and I think that if that happens, if the mare gets pregnant by live cover without us interfering, that means that what was happening was that we were doing something to, you know, interfere or to, you know, reduce the pregnancy or the chances of pregnancy of that mare. So, you know, it is something that, you know, we don't do. So
then it depends on the vet.
Well, I don't think so necessarily, but you know, we'll talk about that. So a mare that fails to become pregnant after 2 tries when she's bred at the right time with good semen should be considered a subfertile mare. And the degree of subfertility varies. You know, it could be low, it could be high, but you know, it should be a problem mare. And she should be dealt with like a problem mare. And why do they become problem mares? Where age, conformation, cervical problems, uterine contractility problems. They don't, you know, evacuate the fluid, delayed uterine clearance, poor uterine defense, infections, you know, that we'll call endometritis. We'll talk a little bit about that here in a second. And also ovarian dysfunction. But, thank you, Haley, very much. I think the most important thing is inadequate reproductive management. If we just, a lot of people think that the time of breeding or inseminating or putting the semen is the most important time of, you know, the breeding process. And that's a necessary step, but it's probably not the most important one. And we'll talk a little bit about that here in a second. So I'm going to give you a tour here of the reproductive system of the horse. And this is the cervix. This is the body of the uterus. These are the horns of the uterus. And these are the ovaries. And if you look at what happens here, this is what a poor sperm has to go through, you know, as they get inseminated. So you'll see here. Maybe we should turn the lights down a little bit. But you'll see here. That's the egg, and you'll see some of these poor suckers bouncing off the thing. It is not survival of the fittest, maybe it's survival of the smartest. And all this thing happens in a very specific place of the reproductive tract. And that is in the fallopian tube, which is the tube, this tube here, that connects the ovary to the uterus. And we have inside that fallopian tube, sperm will live there for hours, sometimes days, depending on the quality of the semen. And then they will wait there for the egg to come around, you know, and be fertilized. So the baby, this new-formed baby, this, you know, very young embryo will live here for the first 5 or 6 days. So now we can also look at this kind of stuff, you know. Where is Jane? There you go, Jane. Maybe you recognize this.
Yeah.
This is
I look at it every day.
Sometimes we have issues with the mare and in that those fallopian tubes are blocked. And the fallopian tubes can be blocked either from the uterine side, or they can be blocked from the ovarian side. And we have now, we're talking with Dr. Cruz to be able to do something about those mares that are blocked or they have oviductal blockage from the ovarian side, because those are things that we can probably do now with the availability of some of the technology. And now here, this is the uterus right here, and what we're looking is for this little area. This is the oviductal papilla, which is where the sperm goes into the oviduct and where the embryo comes out of. And I'm going to see if I can get this thing here. Maybe I won't be able to. Nope, I won't. That's okay. So, now here's the next question. Do you agree that the most common cause of infertility in mares is uterine inflammation? Now we're not going to talk about, I want more than 57. 35, okay, now we're going to put the timer on and see. Now we're not talking about poor reproductive management, this is the mare herself. 54, there's some people that are not don't want to commit. 50-50. Well, the answer is yes, it is. So uterine inflammation is also known as endometritis, which is the inflammation of the inner lining of the uterus. And it's the most common cause of infertility or subfertility in the mare. And there's several types of inflammation. One type of inflammation is normal, and the other ones are abnormal. So the one that is normal is this one that we call breeding-induced endometritis. And that is when we inseminate a mare, we have that mare react to the sperm. The sperm has half the number of chromosomes. It is a completely foreign substance in the uterus of the mare. So the mare reacts to that stuff and says, I don't want that junk. So she wants to expel it. In the meantime, the sperm have about 1 to 2 hours to get up to that fallopian tube. And in the fallopian tube, they'll reside there. This is like a safe haven for them. So, if they get up to the oviduct, they're fine. If they're in the uterus by 4 hours, they get chewed up by all these white blood cells and all this kind of stuff that the mare produces, because she said, I don't want this junk in me. So, now the other ones are this persisting breeding endometritis. So this is the same one, except that this stays in there longer than what it should be. And that's the one that we have to deal with, and that's why we lavage mares and do all this kind of stuff, and I'll show you that here in a second. There's also bacterial, there's postpartum endometritis, there's chronic degenerative endometriosis, and all these are abnormal. And some of these will look, we'll see discharges, we'll see clumping of the hair tails and underneath the mare, and also we'll have all these, when we check the mare with the ultrasound, we'll see, fluid in the cervix or in the uterus. So, how does this happen? How does this uterine inflammation happen, in these mares? Well, the first thing that we have to realize is that when we inseminate a mare, when a mare is mated, there is some bacteria. It doesn't matter how clean the process is, there's going to be some bacteria from the environment, from the glove, from whatever. Now that's obviously the load of bacteria is a lot higher if she's bred by natural cover and the stallion is not washed, the mare is not washed. We do it out in that arena. There's dirt and stuff flying all over the place. So bacteria is a component, but hopefully the majority of it is going to be semen. Now, those two will create an inflammation inside the mare. And that inflammation is created by, or characterized by the movement of white blood cells into the uterus and also the release of some prostaglandin and other stuff. And this inflammation, as I said before, is a transient problem. It lasts a very, very short period of time. We have uterine clearance, and that happens in less than 24 hours. So if a mare is normal, in less than 24 hours, she's going to clean all that junk and she's good to go. Now, the problem is that when we have this persistent endometritis, then what we want to do, and this is our job as veterinarians, is identify those mares that are going to be persistent. Because, you know, if we wait 2 days, well, it's already way past 24 hours. So we need to identify those mares that are potentially persistent, you know, or have that persistent inflammation. And then we want to treat those mares in time so that by 24 hours, there's nothing. Now, if we don't treat, then we have all this big fluid built up in the uterus, and there's more inflammation, and then it creates a vicious circle around here where, you know, we just, you know, behind the 8 ball, you know, to try to get that mare. And those mares, in general, are the ones that are not going to get pregnant, or if they get pregnant, they end up losing the pregnancy. So how do we deal with that? Well, there's several ways that we can deal with that. We can reduce the amount of bacteria. We can reduce, you know, to reduce the inflammation. It would, you know, it would feel like it's an oxymoron to say, well, maybe what we could do is reduce the amount of semen. We all think that, you know, the more is the better. Well, no, actually not. Sometimes if we reduce the amount of semen that we use, we're going to reduce that inflammatory reaction because, you know, the sperm actually is the component of semen that creates that huge inflammation in those mares. And also, obviously, you know, the uterine clearance, which is the lavage and, you know, that kind of stuff. So when we get started, we're going to try to finally get this mare bred. Well, look at this. You know, we're going to decide, you know, if this mare. I normally suggest that almost every mare that has a dubious reproductive history or that has an unknown reproductive history and shows signs of something abnormal, be cultured. The only mare that should not be cultured is a young mare with a followed foot that looks fine, or a young maiden mare that, you know, has never been touched by, you know, by anything. So we do a swab or a culture, and look, here we have, you know, we go in here inside the uterus. We don't touch this area because there's a lot of bacteria here, but there's no bacteria in here. So we try to, you know, move this swab around to try to make as much contact as we can in the uterus. And then, you know, we do a cytology, which is like a pap smear, try to see what kind of, you know, cells there are. If there's inflammatory cells, then we say, you know, like in this case, where you see all these are white blood cells. So when do we do a culture? I said when something does not look right, or when we had a mare that had a long time ago, she had a foal, or she's not pregnant. Non-pregnancy is a sign of problem. If the mare is bred at the right time with good semen, non-pregnancy should be something that, you know, we should take, we shouldn't take lightly. If the mare has fluid discharge, or if the mare has irregular cycles. So we might end up with, you know, this is a very common scenario that I end up dealing with. A mare has been bred twice. She's not pregnant. She's got a negative culture. But the uterus doesn't look right, and it doesn't look right on ultrasound. And that's, you know, where the veterinarian comes into play. Or the mare has irregular cycles. She cycles either too short in between, or she doesn't cycle, you know, at the regular time. She stays out of heat for too long period of time. So now what do? She's got a negative culture, and she's been bred, and she's not pregnant, so now what? Well, in the last 4 or 5 years, we have come to, you know, to develop some new techniques for this kind of stuff. The first thing that you have to do when you run into that scenario, you have to decide, okay, I have to reassess. What is it? Why am I doing this? If the mare is worth $500, the stud fee is worth $2,000. The vet fee is worth $2,000. You're not going to get a $4,500 foal. It will be a $500 foal if you're lucky. So why are you doing this? Well, there's some people that, you know, want to have this, you know, a filly or a colt out of that mare because, you know, she's been in the family for a long period of time, or she, you know, whatever it is the reason. You know, there's a sentimental attachment to that mare and I want to do it. But if you're doing it for business, well, you know, I think this could be something. So you have to reevaluate the expectations, obviously. You have to look at the mare with different eyes. Now you know that she's a difficult mare, you know, and we have to look at the degree of fertility issues that